The World Health Organization and Uganda's Ministry of Health have confirmed 2 more cases of Ebola in Uganda after the virus claimed the life of a 5-year-old boy. The 2 patients whose blood samples tested positive for Ebola are relatives of the boy. The confirmation now brings the number of those who have been infected with a hemorrhagic fever to 3, less than 24 hours after the government announced the child as the first case in the country. 3 others remain in isolation, while 8 people who were in close contact with the infected are being monitored. Health officials from Uganda and neighboring Democratic Republic of Congo, along with representatives from the WHO and the Center for Disease Control, are meeting in Kasisi, the border district in Uganda, where Ebola has been reported, to discuss a joint response to the threat.
So the Ministry of Health would like to inform the public of the confirmation of Ebola virus disease in Kasese district, Uganda. The confirmed case is a 5-year-old boy who traveled from the Democratic Republic of Congo with his mother yesterday. The child was detected by the health workers at Kagando Hospital with signs and symptoms of Ebola, and immediately transferred and isolated at Bwera Hospital Ebola treatment unit for further management. A blood sample was drawn and sent for testing at Uganda Virus Research Institute very early on the morning of June 11th, and the sample tested positive for Ebola.
Now, in the wake of news that Ebola has spread from the Democratic Republic of Congo to Uganda, Rwanda says it is intensifying surveillance at ports of entry. This is understandable as Rwanda shares its border with both countries. In a statement, the health ministry said that Rwanda is taking the Ebola outbreak in the neighboring countries seriously. The country has called for people to be more alert, improve hygiene, and avoid traveling to areas affected by Ebola. Well, back in the DRC, though, the health ministry says over 1,500 people have been killed by measles. This week, the government declared the disease an epidemic in the country. Medical charity Doctors Without Borders then reported that those deaths had been recorded in the first 5 months of the year. Health officials say comprehensive vaccination programs are the only way to prevent measles spreading out of control, but say ill-informed opposition can sometimes thwart such plans. The United Nations Children's Fund launched a campaign, #VaccinesWork, in April, to counter a backlash against vaccination by some parents in different parts of the world. While the DRC health officials are still battling the deadly Ebola virus, concentrated in the eastern region, some 65,000 suspected cases of measles have been reported across the vast Central African country.